Doc on the Run. We help injured runners run.
Should a runner have surgery for a plantar plate injury? That's a great question, and that's what we're talking about today on the Doc on the Run podcast. Okay, this is a really simple question. Should I have surgery to repair my plantar plate injury? Well, there are a couple of reasons that you should consider surgery, and they're really simple. The first one is that if you have tried everything else and nothing will work, and I mean if you have honestly tried it, so saying you kind of messed around with a boot a little bit, or you sort of use crutches, or you sort of taped the toe, or you sort of use some pads, and you're not getting better, that's not trying it. And you have to be honest with yourself about that. But when you have clearly failed all of the things that are non-surgical, and you cannot get better, then surgery makes sense. But surgery should not be taken lightly. There are lots of different surgeries that we can do. Now, we can actually go in and put in some stitching to sew up the plantar plate. We can put in a little bone anchor to reinforce the plantar plate ligament before we sew it up. We can actually cut the metatarsal bone and shorten it to decrease some of the stress and strain. But each one of those various procedures has risks that could actually compromise your ability to run if you get some kind of complication. So, if your doctor says, look, nothing else is going to work, surgery is your only option, well, if you believe the doctor, then you should go ahead and have surgery. I'll tell you one reason why this appeals so much to runners and why runners keep asking me whether or not they should just have surgery. Well, we often think of it as the way we think about things like automobiles. If you have a car that has a four-wheel drive system, for example, and you push the button on the four-wheel drive and nothing happens, what could be the problem? Well, maybe the switch is bad. Maybe the little computer in your car that actually controls the transfer case motor that sends power to both front and rear axles is bad. Maybe the transfer case motor itself is bad. Maybe the wire in between the switch and the transfer case motor, or the wire between the switch and the module, one of those is bad. Maybe the fuse is blown. Could be lots of things. But if you just have a blown fuse, all you have to do is take it out and put in a new one, and then it's working again. And so we always think that human beings act the same way, but they don't. And when you put in a fuse, the body doesn't react abnormally. And sometimes that can happen when you have a plantar plate repair. So if we put in stitches and you have a reaction to Vicryl, the suture that we put in that's absorbable, that's a problem. If you have thick stitching and you get scar around it and it forms a lump that hurts when you run, that's a problem. If you get an infection and it doesn't heal, that's a really serious problem. And if you have bone surgery and it shortens the toe and the toe is all wobbly and you get pain because of that, that is also a problem. Now, there are lots of things that can go wrong when we do surgery, and that's why I really say you've got to exhaust everything else first. So you have to think about all of the potential risks and then weigh whether or not it's actually best for you. So you've got to have a real frank discussion with your doctor about what your goals are. Not that you want the plantar plate injury to go away, but that you really and truly want to be able to run, and you want to know, not is this going to fix the plantar plate issue, am I going to be able to run marathons? Am I going to be able to qualify for Boston? Am I going to be able to do Ironman triathlons? You need to know what the issues are that you're going to be facing afterwards, because I have seen runners who have these injuries and cannot run at all. And if you get so much stiffness in that joint that it causes a different problem, you may not be able to run, at least not at the level that you expect. That's why you got to talk to your doctor. And then the last thing is you have to think about, plan for, and prepare and make sure that you don't get the dreaded post-operative weakness that plagues so many athletes who have surgery and have to take 6, 8, 10, 12 weeks off of training entirely while they're healing that injury after surgery. But obviously, if you're going to have surgery, you have to let it heal, and you've got to do whatever your doctor says after the surgery. So you've got to work hard to build fitness before surgery. You've got to do a lot of stuff to maintain your fitness as you're recovering immediately after the surgery. And then you have to work hard to get back to where you were before. That's just the bottom line. So plantar plate repair can be a reasonable thing to do in terms of a surgical procedure if you've really exhausted everything else, and if and only if it clearly is worth all of the risk. But that is the only time you should really think about having a plantar plate repair surgery.
Doc on the Run. We help injured runners run.